There is no doubt that the world we live in has changed a lot in the last 6 months. We have to deal with this new COVID-19 pandemic, and we are all trying to adapt to this new normal situation. As doctors and part of health fraternity, we are also trying to adapt and provide the best of healthcare possible with least amount of difficulty to our patients. Quite a few of the problems can be dealt with teleconsultation, and hence we at Apollo have a good platform for teleconsultation. So we request our patients who can, if possible, if there is not much of an emergency, use this platform and consult us doctors through teleconsultation forum. That way both you and we are safe. But in the meanwhile, we are just because of COVID-19, other problems are not going to be stopped. Like for example, a patient who is due for delivery will have to come to the hospital for delivery. There could be emergencies like excessive bleeding. They have to come to the hospitals. Being an obstetrician and gynecologist, we are always faced every day to see these patients who come in emergencies. And at Apollo Hospital, we have tried our best to ensure safety of both for the patients and for the healthcare professionals. Even in the outpatient, we have made sure that even whether it's a reception counter or in the waiting area, there has been provisions so that the patient can maintain a social distance. And we request you to be wearing a mask all the time. Even when you especially enter the doctor's chamber and you're trying to speak to the doctor, do not remove the mask, because it's safe both for you and for us. In the meanwhile, even in the outpatient department, they've made sure that the surface cleaning is done at regular intervals, and we as doctors and even the nurses, healthcare professionals, make sure between patients we sanitize ourselves. We are wearing constantly personal protection equipment to safeguard ourselves and also you, so that we don't spread infection among the patients. Even in the inpatient ward, we have taken utmost care that the screened patients who are non-COVID are kept in a separate ward, unknown COVID status are kept in a separate ward. And as far as the obstetrics is concerned, even our delivery ward is separate. All the patients are screened beforehand, made sure the COVID negative patients are placed separately. Even the healthcare professionals, we are constantly wearing personal protection equipment. We together, you and me, can overcome this challenge of COVID-19 if we work together. You have to help us to help you all in this situation.